just want to talk to you a little bit about holding patterns, or other people probably know it as altered movement patterns. In the next sort of month or two, we're going to be introducing you to a really, really amazing hip technique that I've been working with for quite a while. The basis of this hip technique is all about understanding how holding patterns or altered movement patterns happen. The simple explanation for it is probably when you're looking particularly at athletes that push the boundaries of their endurance thresholds. Now when that happens, as all athletes do, because that's part of the training cycle, is to push your body and obviously gain stronger and faster and all those benefits that you get from obviously working at a high performance level, is that when you reach these endurance thresholds, what tends to happen is the prime movers in that movement pattern will start to fatigue, and what we're seeing there is a down regulation, the activity of that muscle. Now what inevitably happens there is another muscle within that movement pattern will then upregulate. Basically, unfortunately, it's probably not designed for that, but more than likely this is the body's way of trying to compensate. And then what happens is if we do that enough, the body starts to adapt to that. And we can use the philosophy, if you like, of that neuroplasticity. So the body starts to rewire and we start to develop these holding patterns. Inevitably, what we see is the relationships between the agonist and the antagonist. So for me, in terms of obviously looking at the hip, one of the first things that we look at when we're assessing and wanting to treat hip dysfunction, especially from this parameter or paradigm, is looking at hip extension. So the first thing that can start to happen is our iliopsoas, especially this anterior hip portion, will start to become overactive and short. And what that does is it'll inevitably inhibit our glute max, which is our prime moving muscle, obviously extension. So as that, we have less obviously range of movement through that hip extension. It means we're not getting to use all of that glute max, which is the prime mover. Our industry has been funny because there's a lot of terminology thrown around that this muscle starts to get weak. In actual fact, we need to be looking and seeing if it's being inhibited, therefore not weak. So strengthening that would be actually counterproductive. I hope you enjoy that. I'm going to bring you more. Obviously, we're going to expand the hip technique, and you'll find that understanding different holding patterns obviously will mean obviously a different treatment process. So I look forward to it.